over 60. Never do these 5 medical tests. They may do more harm. If you're over 60, you've probably been told that regular medical checkups are the key to staying healthy. But here's the shocking truth. Some of these routine tests can actually harm you more than they help. We're talking about false positives that lead to unnecessary surgeries, overexposure to dangerous radiation, and procedures that can weaken your body instead of protecting it. Many seniors discover this too late, after they've already faced complications that could have been avoided. Doctors rarely discuss the hidden risks because these tests have been a standard part of care for decades. But medical research now shows that in older adults, the balance between benefit and harm can flip. Today, we'll go from number 5 to the single most dangerous test at number 1, revealing the real risks and what to do instead so you can make safer choices. Protect your independence and avoid unnecessary suffering. Stay tuned because the number 1 test on this list is one most seniors never question until it's too late. Number 5. Annual full-body CT scans. For many seniors, the idea of getting a yearly full-body CT scan feels like buying the ultimate insurance policy for your health, a way to catch anything early before it becomes serious. It's an appealing thought, especially if you've lost friends or family members to illnesses that seem to come out of nowhere. But here's the part most people over 60 aren't told. These scans can quietly do more harm than good. Unlike a simple X-ray, a full-body CT scan delivers a significant dose of ionizing radiation in some cases, up to 100 times more than a chest X-ray. Radiation isn't harmless. Its effects are cumulative, meaning the more you're exposed over your lifetime, the higher your risk of developing radiation-induced cancers. For seniors who have already had decades of medical imaging, dental, X-rays, mammograms, chest scans, that extra annual dose pushes the risk even higher. And it's not just about cancer. Full-body scans are notorious for finding incidentallomas, harmless spots, tiny cysts, or age-related changes that are completely normal. But once these show up on a scan, doctors feel obligated to investigate. Further, that can mean more tests, invasive biopsies, or even surgeries, each carrying their own risks like infection, complications from anesthesia, or long recovery times that steal away your mobility and independence. A 2023 review in JAMA Internal Medicine found that false positives from advanced imaging lead to unnecessary interventions in nearly 30% of cases for adults over 60. I once spoke to a retired teacher in Florida who got a full-body scan, just to be safe. It showed a small spot on her lung. After months of follow-up tests and a painful biopsy, doctors concluded it was scar tissue from a childhood infection. She went through physical pain, emotional stress, and thousands in medical bills for nothing. These stories aren't rare. They're happening quietly, every day. Two well-intentioned seniors who just want to stay healthy. Better tip: skip routine full-body CT scans unless you have specific symptoms or a clear medical reason. Ask your doctor about targeted imaging that focuses only on areas of concern. It cuts your radiation exposure dramatically, reduces false alarms, and ensures any follow-up care is truly necessary, protecting both your health and your peace of mind. Number 4. Routine colonoscopies after 75. For decades, colonoscopies have been considered the gold standard for detecting colon cancer early. And for many adults between 50 and 70, they are a life-saving tool. But after the age of 75, and sometimes even earlier, depending on your overall health, the balance between benefits and risks can shift dramatically. The procedure itself may seem simple, but it's not without danger, especially for older adults. A colonoscopy requires sedation, which can cause disorientation, low blood pressure, and even heart complications in seniors with existing cardiovascular issues. The bowel preparation, that intense day of fasting and strong laxatives, can lead to dehydration, electrolyte imbalances, and in some cases, dangerous falls from dizziness. Then there's the risk of perforation, when the colon wall is accidentally punctured during the procedure. While rare, it's more common in people over 75 due to natural thinning of the intestinal walls with age. And when it happens, it often requires emergency surgery with long, difficult recovery periods. The U.S. Preventive Services Task Force now recommends stopping routine colonoscopies after age 75 for most people, because the potential harm begins to outweigh the benefit, especially when cancer typically takes years to develop and may not pose a significant threat in your lifetime. Yet many seniors are still urged to repeat the procedure just to be sure, sometimes every 5 years or even more often. I remember speaking to a 78-year-old man from Ohio who followed his doctor's advice for a routine screening. During the procedure, a perforation occurred, leading to emergency surgery. He spent weeks in the hospital, lost a significant amount of weight, and took nearly a year to regain his mobility, all for a cancer screening that guidelines said he no longer needed. These are the stories that rarely make it into polite conversations about prevention, but they're an important reality. Better tip: if you're over 75 and have had normal colonoscopies in the past, talk to your doctor about switching to non-invasive options like fecal immunochemical tests, FIT, or stool DNA tests every 1, 2, 3 years. These can still catch signs of trouble without the sedation risks, invasive procedure, or long recovery time, keeping you safer while still protecting your health. Number 3. Annual PSA screening for all men over 70. For men over 70, the idea of a simple blood test to check for prostate cancer sounds like an easy, harmless precaution. After all, the PSA prostate-specific antigen test only requires a quick blood draw, so how could it possibly be dangerous? The truth is, the real risk comes not from the test itself, but from what happens after a slightly elevated result. PSA levels can rise for many reasons that have nothing to do with cancer, such as benign prostatic hyperplasia, BPH, inflammation, or even recent sexual activity. Yet even a small bump in PSA often sets off a chain reaction: more blood tests, Mr. Is, and most importantly, prostate biopsies. These biopsies involve inserting needles into the prostate through the rectum to collect tissue samples. And for seniors, they carry significant risks: bleeding, infection, urinary problems, and in some cases, sepsis requiring hospitalization. And here's the deeper issue: many prostate cancers found in older men are so slow-growing that they would never cause symptoms, let alone threaten life expectancy. But once diagnosed, the word cancer triggers fear and urgency, leading to aggressive treatments like surgery or radiation. These treatments often cause long-term side effects, such as urinary incontinence and erectile dysfunction, which can have a devastating effect on quality of life. A major 2018 study in the BMJ found that PSA screening in men over 70 led to overdiagnosis in more than 60% of cases, meaning cancers were found that would never have become life-threatening. I recall speaking with a 72-year-old retired Navy veteran who got his PSA checked at his local clinic just to be safe. The slightly elevated number led to a biopsy, which caused a severe infection. He spent a week in the hospital and months dealing with urinary complications, only to find out the tumor was so small and slow-growing that it likely never would have caused harm in his lifetime. This is the hidden cost of routine PSA screening. In older men, a path of invasive procedures, side effects, and anxiety, all for conditions that might never have been a threat. Better tip: if you're over 70, discuss the risks and benefits of PSA testing with your doctor before agreeing to it. For many men in this age group, active surveillance, monitoring symptoms, and occasional targeted tests is safer than routine annual screening, avoiding the cascade of unnecessary interventions while still keeping an eye on your health. Number 2. Annual cardiac stress tests without symptoms. For many seniors, heart health is at the top of the list of concerns, and it's understandable why. Heart disease remains the leading cause of death for people over 60 in the United States, so when a doctor suggests an annual cardiac stress test just to check, it feels like the responsible choice. But here's the reality. If you have no symptoms of heart disease and no recent changes in your health, these yearly treadmill or chemical stress tests can set off a chain of events that may actually put you in harm's way. The test itself, especially the chemical version, can cause side effects like shortness of breath, chest discomfort, dizziness, and in rare cases, irregular heart rhythms. But the real danger comes from false positives, test results that suggest a problem when there isn't one. In seniors, especially those with age-related changes in heart structure or blood vessels, false positives are surprisingly common. And once a test raises suspicion, the next step is often an angiogram or cardiac catheterization. These are invasive procedures involving threading a tube into your heart's blood vessels. And they carry real risks: bleeding, stroke, kidney damage from contrast, dye, or in rare cases, death. What's even more alarming is that in many cases, these procedures don't improve long-term outcomes for people without symptoms, but they can lead to stent placement or even bypass surgery that might not have been necessary. A 2014 JAMA cardiology review concluded that in asymptomatic older adults, routine stress testing led to more harm than benefit in the majority of cases, largely due to unnecessary interventions. I once spoke to a 74-year-old grandmother from Arizona who took her doctor's advice to have a chemical stress test every year. One slightly abnormal result led to a catheterization, during which she suffered a small stroke that left her with partial vision loss. Later, another cardiologist reviewed her case and concluded she never needed the test in the first place. Her heart was healthy for her age. Stories like this highlight the quiet risk of turning a precaution into a yearly ritual. The test might not just be unnecessary, it could change your life for the worse. Better tip: if you have no chest pain, shortness of breath, or other cardiac symptoms, skip routine annual stress tests. Instead, focus on lifestyle measures, regular walking, a heart-healthy diet, and blood pressure control and reserve advanced cardiac testing for when you and your doctor see clear signs that something might be wrong. This keeps you out of the cycle of false positives and unnecessary interventions while still protecting your heart health. Number 1. Unnecessary follow-up imaging after minor findings. This is the hidden trap almost no one warns seniors about, and it's the reason so many older adults end up caught in months or even years of unnecessary medical procedures. It often starts innocently. You have a scan for a specific reason, maybe a CT after a fall, or an X-ray for a stubborn cough, and the radiology report notes something incidental: a tiny lung nodule, a small kidney cyst, a shadow on the liver. The report often ends with the phrase, "clinical correlation advised," or "follow-up imaging recommended." To most patients, that sounds like a warning siren, and fear kicks in immediately. But here's the truth. In people over 60, the vast majority of these findings are completely benign, caused by old infections, scar tissue, or harmless age-related changes. Yet once the recommendation is made, the medical system tends to run with it. That means repeat scans every 3 to 6 months just to watch it, exposing you to more radiation each time. And each new scan has the chance of picking up additional incidental findings, leading to an ever-expanding list of things to check. Soon, you're booked for Mr. Is, ultrasounds, or PET scans. And if anything changes even slightly, you might be sent for a biopsy. These biopsies can carry real dangers. Lung biopsies risk collapsed lung. Liver biopsies risk internal bleeding, and even minor needle procedures can lead to infections that hit seniors especially hard. A 2022 Annals of Internal Medicine review found that over 60% of incidental findings in seniors led to follow-up tests, but fewer than 5% revealed anything requiring treatment. That means the overwhelming majority caused anxiety, cost, and risk without improving outcomes. I recall speaking with a 69-year-old retired postal worker who had a chest CT after a bicycle accident. The scan showed a 4 mm lung nodule. Over the next 2 years, she underwent 5 additional CT scans, a PET scan, and finally a biopsy, all to confirm what one pulmonologist suspected from the start. It was a harmless calcified scar from pneumonia. Decades earlier, she endured radiation exposure equivalent to hundreds of X-rays, months of anxiety, and a painful recovery from the biopsy, all for something that never threatened her health. This is the perfect storm: fear of missing something, the pressure to act, and a medical system that defaults to more testing rather than watchful waiting. For seniors, the toll isn't just physical, it's emotional and financial, robbing you of peace of mind and independence. Better tip: if a scan shows an incidental finding, don't rush into a schedule of repeated imaging without a clear reason. Ask your doctor about the likelihood that it's harmless based on size, shape, and your history. In many cases, a longer interval before rechecking or even no further imaging is safer, sparing you unnecessary radiation, procedures, and worry, while keeping you focused on what truly matters for your health. When you're over 60, every medical decision matters more. The goal isn't to avoid care, it's to choose care that helps, not harms. Too often, routine tests and follow-ups are scheduled out of habit, not necessity, and the result can be a spiral of radiation, invasive procedures, and anxiety that steals time from the life you're trying to protect. By asking the right questions, focusing on tests with clear benefits, and saying no when the risks outweigh the rewards, you take control of your health in a way that truly supports your independence. The safest choice isn't always the one that feels most proactive sometimes. It's the choice to wait, watch, and live without unnecessary worry. What do you think? Have you ever been pressured into a test you didn't really need? Share your story in the comments. Your experience might just help another senior make a safer decision.